Nora-Be is a medication used to prevent pregnancy and is often called the mini pill because it does not contain any estrogen. It contains a hormone called norethindrone, which prevents pregnancy. This mini pill is more effective than some other methods of birth control, like condoms or diaphragms, but it is less effective than combination hormone birth control because it does not consistently prevent ovulation. It is usually used by women who cannot take estrogen. To reduce the risk of pregnancy, it is important to take this medication exactly as prescribed. It does not protect against sexually transmitted diseases. The daily dosage is 1 tablet at the same time every day, and it is best to take it at a consistent time to help with effectiveness. When starting Nora-Be, it's important to read the patient information leaflet provided by your pharmacist for important information on when to take your pills and what to do if you miss a dose. Take this medication by mouth as directed by your doctor, usually once daily. It's best to pick a time of day that is easy for you to remember, and take your pill at the same time each day. You may choose to take this medication after your evening meal or at bedtime if you experience stomach upset or nausea. It's important to begin taking Nora-Be on the first day of your menstrual period. If you start on any other day, use an additional form of non-hormonal birth control for the first 48 hours. Continue taking 1 tablet every day and start a new pack the next day after finishing the last tablet in a pack. If you miss a pill or take it 3 or more hours later than usual, use a backup method of birth control for the next 48 hours. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of Nora-Be may include nausea, vomiting, headache, bloating, breast tenderness, or weight gain. You may also experience vaginal bleeding between periods or have missed or irregular periods. If any of these effects persist or worsen, notify your doctor or pharmacist. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, contact your doctor for a pregnancy test. It's important to remember that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you have any serious side effects, such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing eyes/skin. Although it is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. Before starting Nora-Be, make sure to let your doctor or pharmacist know if you are allergic to norethindrone or other progestins, as well as any other allergies you may have. It's also important to discuss your medical history, particularly if you have had abnormal breast exams, endometrial or breast cancer, low levels of good cholesterol, depression, diabetes, severe headaches/migraines, liver disease, or unexplained vaginal bleeding. If you are planning to have surgery, inform your doctor or dentist about all the medications and herbal products you are using. Nora-Be may cause blotchy, dark areas on your face and skin, and sunlight can worsen this effect. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. This medication should not be used during pregnancy, and if you become pregnant while taking Nora-Be, you should notify your doctor immediately. Additionally, Nora-Be passes into breast milk, so it's important to consult your doctor before breastfeeding. Drug interactions can affect how well Nora-Be works and may increase the risk of serious side effects. It's important to keep a list of all the medications and products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some drugs, like griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, and drugs used to treat seizures, may cause Nora-Be to work less effectively, increasing the risk of pregnancy. If you start a new drug, discuss with your doctor if you should use additional reliable birth control. Also, let your doctor know if you experience any new spotting or breakthrough bleeding, as it may indicate that Nora-Be is not working effectively. It's important to inform your doctor if you are taking Nora-Be before undergoing any lab tests, as it may interfere with certain test results. Make sure all lab personnel and doctors are aware that you are using this medication. If you suspect an overdose and see serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center. Symptoms of overdose may include severe nausea, vomiting, and sudden or unusual vaginal bleeding. Remember, it's important to seek medical help right away if you suspect an overdose. Remember not to share your Nora-Be medication with others. It's important to have regular physical exams, including lab tests and medical tests like blood pressure, breast exams, pelvic exams, and pap smears while taking this medication. Follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you miss a dose of Nora-Be, refer to the package information for advice on what to do. You may need to use backup birth control, like condoms or spermicide, to prevent pregnancy. If you have any questions, ask your doctor or pharmacist. If you frequently forget to take your pills as directed, contact your doctor to discuss switching to another form of birth control. Make sure to store Nora-Be at room temperature, away from light and moisture. It's important to keep all medications out of reach of children and pets. When it comes to disposing of Nora-Be, do not flush it down the toilet or pour it into a drain unless instructed. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember, it's important to handle medication safely to protect your family and the environment. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.